Hi, my name is Peyton, and I'll be talking about the complication known as appendicitis. So, what is appendicitis? Appendicitis is inflammation of the appendix, and it is the narrow tube that extends from the most inferior portion of the lowest point of the cecum, which is the cecum is the small, what connects the small intestine to the colon. And the most common cause of appendicitis is usually an obstruction of an accumulation of feces over time. So accumulated feces sits in that one area for a large amount of time or a long amount of time, which causes an enlargement of the area. Therefore, there is an inflammation of the appendix, which can cause several complications for a patient. So then we can move into some diagnostic testing for appendicitis. So as a nurse, you'll want to get a complete history of the patient, of course, and go through a full physical assessment. You also want to get some labs drawn and paying close attention to the white blood cell count on the lab. That'll let you know if there is an infection of some sort. Oftentimes, if the situation is not extremely urgent, meaning it's not going, the provider or the nurse doesn't think the appendix is going to rupture, you'll have time to get a CT. But the tests want to be done quickly because it can, if the testing is prolonged, it can actually give time and space for the appendix to actually rupture, which can then cause death and septic shock and many other complications for the patient. So the nurse will want to get those diagnostic studies done very quickly to avoid complications. So the clinical manifestations of the disease usually is a periumbilical pain, meaning around that lower abdomen area. Basically, the patient may complain of pain, lack of appetite, they may be nauseous or have some vomiting spouts, but the pain is usually described as persistent and continuous and has a very classic sign of being having rebound tenderness over what's called McBurney's point, which is the halfway point between the belly button, so the umbilicus, and the iliac crest. So if there's rebound tenderness in the lower right quadrant in that specific area, it's very classic of appendicitis. Sometimes a patient may present with a fever. It depends on what part of the stage that they're in. But coughing and sneezing and any pressure to that lower abdomen may worsen the pain for the patient. So it's really important for the nurse to pay attention to those details. So as far as interprofessional care, the nurse may, of course, want to get a CT if we have time, maybe an MRI of the area. The surgical team will need to be consulted along with the physician if there is need for an appendectomy, which is the removal of the appendix, if that is appendicitis. So the nurse will also need to have time and the team to prep the patient for surgery during that time. So the treatment plan and medications used for this problem, the treatment plan, well, obviously, as I already mentioned, is the surgical team. So if it is an appendicitis situation, the patient does need to go an emergency appendectomy, which is the actual removal of the appendix. The patient will want to start antibiotic therapy prior to the surgery if there's time to do that, which helps them avoid complications with infection during and following the procedure. So the patient will want to continue antibiotic therapy after the surgery. The patient will also want to get up and walk and ambulate as soon as possible after the surgery, making sure that they're stable, of course, which will help them avoid infection and other post-operative complications. So that would be the treatment plan following the appendectomy. So next is the nursing process, and that obviously is assessment, diagnosis, plan, intervention, and evaluate. So the nurse obviously is going to assess for signs and symptoms of appendicitis. The nurse is then going to diagnose, saying the patient is having, rebound tenderness, extreme pain over McBurney's point. They'll want to have a white blood count. Notice the white blood count is elevated from their assessment. So the patient then is going to want to pee to call the physician, get a consult, request for surgery, and start the antibiotic therapy as ordered by the physician. Next, the nurse is going to walk the patient through what the appendectomy surgery is, get an informed consent, those types of things. The appendectomy and the intervention is performed and antibiotic therapy is started. So that's the intervention. And then the evaluation portion, labs can be drawn again following the surgery, and the patient's white blood cell count will be monitored and compared from prior to surgery into after the surgery. When the white blood cell count is back within the normal range and not elevated, that tells the nurse and the physician that there's no longer an infection and that the patient is tolerating the surgery well. So that's the evaluation portion, and that is what I would recommend for ADPI. So the final piece here is teaching the patient. So what does the patient need to know after their appendectomy procedure? So I'll backtrack. The nurse needs to obviously teach the patient about the surgical procedure and what that's going to entail. And then following the procedure and after that teaching, the nurse is going to want to teach about what to do after. What is the aftercare? So a lot of it has to do with that incision point. So the nurse needs to educate about wearing loose fitting clothes so it's not tight on that incision, doesn't cause more pain and more irritation to rub on the incision to cause other complications. The nurse needs to educate about not soaking the incision in water, a hot tub, swimming, getting it submerged in water. The patient can wash the incision, but it needs to be gentle with soap and water. Being careful not to scrub over it because that can cause obviously irritation to some part of the incision point. The patient should not lift heavy objects because that straining can cause that incision to have rupture or burst open and just prolong the healing time. So they need to get a healthcare provider to look at the incision before they can go back to the gym and perform their job duties if it requires heavy lifting. The nurse can also offer a stool softener. So that can help when the patient is using the restroom. They don't need to be straining to go down to go to the bathroom, so a stool softener can help that, which also does help with like post-surgical complications too with constipation. The patient should contact the healthcare provider if they have any questions about the antibiotic therapy, and they also should contact the healthcare provider if there are any other complications moving forward after the procedure is done. So this is all part of the teaching for after the surgery of an appendectomy. The nurse also needs to pay close attention to show the patient how to monitor and continue on with their antibiotic therapy following the procedure. So I hope that you learned something about appendicitis, and